Starting with table 1, the head and neck muscles, we have the frontalis, which the action of that is the raising of the eyebrows. Then we have the masseter, and the action of this is the elevation of the temporomandibular joint, so the clenching of the jaw. Then we have the orbiculus oculi, which the action of that is the closing and blinking of the eyes. And then there's the orbiculus oris, and the action of that is the closing and the protrusion of the lips. The next one is the plasma, controls the tensing of the neck. And then we have the temporalis, which controls the elevation and retraction of the mandible. So then there's the zygomaticus, which controls the elevation at the corners of the mouth, so helps you smile. Okay, so moving on to table 2. First we have the sternomastoidoid. The action of this muscle, the bilateral, is the flexion of the neck. And the unilateral is the rotation of the head to each opposite side. Next we have the external oblique. The actions of this muscle, bilateral, is trunk flexion, and unilateral is unilateral flexion to each opposite side, and the unilateral rotation to each opposite side. Next we have the internal oblique. The actions of this muscle are the bilateral flexion, unilateral flexion, and unilateral rotation to each opposite side. After that we have the rectus abdominis muscle, and the action of this muscle is trunk flexion. Next we have the transverse abdominis, and the action of this muscle is trunk compression. Okay, moving on, we have the pectoralis major. The actions of this muscle are shoulder adduction, internal rotation, and horizontal adduction. Okay, and after that is the pectoralis minor. The actions of this muscle are scapular protraction, so like this, and downward rotation. Moving on, we have the serratus anterior. For the upper fiber actions of this muscle, we have the scapular downward rotation. The middle fibers, the action is the scapular protraction. And for the lower fibers, the action is scapular upward rotation. Next muscle is the external intercostals. The action of this muscle is the elevation of the cartilage, or the ribs, during inhalation. And the last muscle is the erector spinae. And the actions of this muscle are the bilateral trunk extension, and to help maintain posture, and unilateral trunk flexion. Thank you.